Today, I'm joined by four wonderful panelists who will bring their experience and expertise to this discussion about community health workers and health equity. We'll be exploring this topic through the lens of One Neighborhood Builder's work over the last several years in growing our community health worker capacity, as well as our investment in building the community health worker workforce through our registered apprenticeship program. So I'm going to introduce each of the panelists sort of as we go. And with that, I'm going to start with my colleague, Karen. Karen Zuniga is the Assistant Director of Programs at One Neighborhood Builders. Karen, can you tell us a little bit about yourself and then provide an overview of One Neighborhood Builders' community building work and how community health workers fit into that?
Sure. Good morning, everyone. Thank you for joining the conversation. So a little bit about myself. I am a first-generation student and graduate. My parents migrated to Central Falls from Columbia, and I moved to Providence as an adult a few years back. I think it's important to start the conversation to talk about how critical it is for a CHW to be representative of the community that they are serving. They build a trust and connection with residents to facilitate access to quality care and social services. For those on the call who are here and know 1MB for developing affordable housing, we also serve as the Central Providence Opportunities Health Equity Zone. And our deep focus is in neighborhoods in 02909 and 02908. And the work mainly lives with our team. I'm not saying we're the best team, but the amazing community building team. And so the idea of health equity zones backbones is to convene a collaborative with the goal to reduce health inequities alongside our collaborative members and our residents by making place-based investments. Having a team of community health workers has helped provide direct services to our residents, establishing trust and connection, especially during COVID-19, which I'm sure many of you heard about CHW work during COVID-19. We had been critical frontline workers supporting COVID-19 pop-ups, testing sites, and providing quarantine support, distributing critical information, and informing Rhode Island COVID-19 strategy. But they also continue to support our community by informing our team, the organization's commitment to upstream solutions, the Rhode Island Department of Health, our collaborative members, and our residents. They help to inform what our community actually needs on a day-to-day basis because they're working with residents on a day-to-day basis. We started with one part-time CHW and have learned and shifted, and that's when we established our apprenticeship model. And our team has expanded and grown. We have an incredible CHW supervisor. I'm not sure if he's on, but Dennis, and our amazing team of CHW team members at 1MB, but we also lead a multi-employer CHW collaborative and collective. And many of the ones that have joined our collective are part of our apprenticeship program.
Thank you, Karen. And we're going to get into all that exciting stuff about the multi-employer apprenticeship program as we kind of dig in here. I'm going to kick it to Brady. Brady Dunklee is a program manager for population health at Integra Community Care Network. And he's also an instructor in Rhode Island College's community health worker certification training. Brady, can you introduce yourself and tell us a little bit about the broader field of community health work, given your vantage point in the healthcare sector? Like, where do CHWs work? What are the core skills and competencies that community health workers, or CHWs, as we're all calling them here in this conversation, bring to their work on a day-to-day?
Well, good morning. Thank you for the invitation to talk about what's my really favorite subject in the world, community health workers. I'm manager of community health strategy at Integra, where I get to focus on social determinants of health issues, specifically homelessness and food insecurity, and supporting our community health worker team. As you mentioned, I also do some side work for Rhode Island College as an instructor in the community health worker core competency training. I came to this work from the first part of my career in nonprofits, specifically adult education and working in Nicaragua in community development. I know a couple of people on the call from my workforce development and adult ed days. I saw in that work people working formally as community health workers in our work in Nicaragua, and sort of informally peer-to-peer supports in the kind of adult ESOL classroom, and got really, I guess, inspired by that kind of human connection at the sort of roots of health, of letting people who are suffering know that they're not alone, and sort of accompanying people through these really complex life situations and transitions and illness, and trying to find ways to empower people and build their strength from a community perspective. So I made a transition to public health 5 or 6 years ago, and have been trying to work to support that kind of work since then. And I think I jumped in at a pretty good time in the community health worker space. That work has been going on for decades, but there has been sort of an inflection point where I think in the United States, the recognition of the importance of social determinants of health, even before the pandemic, and is sort of the inability, like we can't ignore that now. I think both the importance of social factors for people's health and the deep and deep-rooted sort of inequities that structure that. And I think that has resulted in great momentum and enthusiasm and growth for the community health worker field. You asked where CHWs are working. I was able to do a couple of reports for the Rhode Island Department of Health that aim to answer that question to some extent. And there's some other resources from the health department that do answer that. I'll just drop that link in the chat to those reports. But I would say that they work at the intersections of health and the upstream factors that cause health and cause illness. So that means not only that they work in the healthcare sector, whether that's for payers, healthcare organizations, et cetera, but also for social service and nonprofits, community-based organizations, schools, all of the sort of things that work on what causes our health. And I think housing is right at the core of that, and the work that you do reflects that. So I'm happy to talk about all those things.
Thank you so much, and thanks for including those resources in the chat. I'm now going to ask Marimir to introduce herself. I see you made it through the fire alarm that was going off in your office right before we got started here. So Marimir Lora is a community health worker supervisor at the Providence Community Health Center, and is a graduate of the Community Health Worker Registered Apprenticeship program that we've mentioned a few times here. Marimir, can you tell us a little bit about yourself and how you became interested in becoming a community health worker?
Sure. Thank you for the introduction. Can you guys hear me well? Because I'm in another building, so I want to make sure. Okay, so hello, everybody. As she mentioned, I'm Marimir Lora, and I'm the supervisor of the Community Health Advocates, PCHC. And a little bit of backstory about me is I came to the United States 7 years ago. I moved to Providence. I graduated of marketing and finances in my country, the Dominican Republic, and I didn't like that, so I went to medical school. I couldn't finish because I have to move to the United States, and I started working at a hotel as a housekeeper. After that, I became a CNA, and that's when I started to like the idea of, helping people and all of that. So I got really into that mood, and I was that person in the family that did it all. I basically helped all my family. So I went to CCRI to pursue a career in nursing, which I thought, because I have that background in medicine, that's the only way that you can actually help people. That was my mindset back then. So a family member actually put me into the apprenticeship. They saw it posted and they were like, oh, I think this is for you. I think you'd be great for that. And you just have the passion and you like to help people. So I applied without even knowing what it was, actually. I had no idea what it was. And I just went for it because I really liked the idea of being with community. So I did, and I got the job. And I like to describe the apprenticeship that the opportunity that changed my life. I actually wanted to pursue the career, and I identified that you don't have to be a nurse or a doctor to be able to help your community, to help people. And the relationship and the connection that I built in the apprenticeship, it's something that I will ever be grateful for. So that's just a little bit of story about how I got into the apprenticeship. And yeah, it's a story after that.
Thank you, Marimir. We have more questions for you coming, don't worry, but thank you for that initial kind of overview of how you got into the work. And then I want to introduce our final panelist, Surbhi Sardana, who is a manager of network learning at NeighborWorks America. Surbhi, can you tell us a little bit about yourself, maybe a little bit about NeighborWorks for folks who are not familiar with the organization, and then specifically about the community health worker peer learning cohort that NeighborWorks has led?
Sure, yeah. Thank you, everybody, and thank you for having me on this wonderful panel this morning. So hello, everybody. My name is Surbhi Sardana, and I am the manager of network learning at NeighborWorks. So really quickly, NeighborWorks is a national nonprofit that essentially does affordable housing work. And really their, I think, biggest role is in that they have about 250 or so member organizations across the US. And we really try to support these local organizations through grant funding, technical assistance, training. We do lots of training institutes. And just generally trying to pave the way in affordable housing for a lot of our member organizations. So I actually came to NeighborWorks a little over a year ago and made the transition to the housing community development space after having worked in the private and public health space for a few years. So still learning a lot about community development and all the overlaps with the social determinants of health and public health and all of that. So it's been a really great experience. But in a nutshell, in my role as a manager of network learning, I support the various programs of our community initiatives division at NeighborWorks with communications and essentially advancing peer and network learning, like through grant programming for our member organizations. So the Community Health Worker Learning Lab, which one is actually a part of, is a program that's offered by our, it's a grant that's offered by our Healthy Homes and Communities program to 12 NeighborWorks network organizations. And these organizations are those who are either looking to implement a community health worker model, completely new, looking into it, exploring it, or are two, just like one, looking to expand or scale an existing CHW program. So through this grant program, in addition to funding, grantees receive coaching, training, and technical assistance to advance their CHW model. So of course, lots more to dive into about this peer learning program, but I'm looking forward to talking more about that today and hearing from others.
Thank you, Surbhi, and thank you to all the panelists for your initial comments. So as you can see, there's lots of threads to this broader conversation. And I think one of the through lines is this kind of movement more broadly. One, kind of the recognition of the importance and value of community health workers, and how organizations like in the healthcare sector, organizations like NeighborWorks and other national entities are really moving towards deeper investment in community health workers and their role in community-based organizations, as well as other types of organizations. So with that sort of transition, I'm going to put my next question back towards Brady. So I just mentioned a little bit about the deeper investment in community health work. Can you talk a little bit more in your role from your role at Integra in the healthcare space? What value do organizations like Integra, like the healthcare generally, see in community health workers? What do you think is driving some of this greater investment in community health workers as one of the tools in the tool belt of meeting folks and their needs where they are?
Try to answer that from two or three perspectives. The sort of macro perspective might have to do with kind of financial policy and the move towards value-based payment, which means, essentially finding ways that to pay for healthcare that has to do with keeping people healthy, as opposed to paying more for sicker, pay for volume, what gets called a sick care system. There have been major moves in that direction, of which the accountable care organization model is a part. Integra is an ACO, and within that we have an accountable entity program, which is Rhode Island's Medicaid version of an ACO. In that we're incentivized to work at the population level and work to drive down healthcare costs. And that actually opens up some really important opportunities for doing work upstream. If you want to keep people healthy at the population level and reduce healthcare costs overall, you need to be thinking about social determinants of health. You need to be thinking about care coordination, sort of longitudinal, or working with people over the long term to see the big picture of their health, and not sort of specialist to specialist to specialist, and how do you get at the roots of the problem. There may be a role that does that better than a community health worker, but I haven't seen it. I think having someone who can really look upstream and understand the big picture of what's causing, what's going on with someone's housing, someone's behavioral health, someone's diet, someone's trauma, someone's family life, someone's community, someone's experience of violence, someone's medication management, all these things, how to knit this together and how to be with that person to empower them to reach their health goals. I think that's been the missing link for healthcare. We have a huge amount of specialty and treatment, but someone to see the big picture and get upstream of it, I think that's the move. And there are other professional roles that try to do that, the nurse care manager, social workers, and others. So from the macro perspective, there are new-ish financial incentives to do that. From the primary care perspective, I think we hear from primary care that is working with our team of community health workers or in other contexts, just that what a difference having that role makes. If you're in the clinic and you can't see what's the disconnect at home in terms of someone adhering to medication or changing their behavior, ultimately you're frustrated. You have these small increments of time with people, and you may not be able to make the change without those factors coming in, and a CHW can play those roles. I think just also seeing the humanizing element of how CHWs work and moving towards a more equitable approach, and that incorporates the sort of fact of historical mistrust, particularly with oppressed and marginalized populations. I think all of those things play into why healthcare is or should be seeing the value, and we certainly do.
Thank you. And Karen, you mentioned during your initial comments how One Neighborhood Builders started with one half-time community health worker, and over time has grown through additional investment from private sources and public sources to build the team that we have today. Can you talk a little bit about what made One Neighborhood Builders decide, in addition to having community health workers on our team, we want to invest our resources and expertise in building this registered apprenticeship program, so that community health workers, that organization, and more broadly are sort of working towards a certification and a set of standards in the field?
Yeah, I think that we started as, like I mentioned, we had one part-time CHW, and what One Neighborhood Builders learned rather quickly is the need to establish a structured program. Like a part-time CHW, we learned, people are coming in, they need and want to speak to someone like Yuseli, and that's the CHW that was in place. She's from the community. That's who they connect with. That's who they want to speak to. And so we found that, we need more folks on this team, because as much of us who know about CHW work is that we experience burnout if there's not enough support in place. So One Neighborhood Builders expanded the CHW team, and then also, as we learned, we also need CHW supervisors. We need an entire team that's supporting the the team itself, and also a collaborative that can inform the work that the resources that are being provided in the community. And we've learned rather quickly that it is the CHWs informing our work, but how often we have to shift based on our relationships with our CHWs. So I think that what One Neighborhood Builders also learned rather quickly is that they have aligned well with what our mission is with our health equity zone. We wanted to provide a livable wage for folks in the community. And that was the main goal and objective of establishing this apprenticeship model, where we have people from the community on the job learning, providing a livable wage, providing mentorship, providing additional training, and it's been a success. So.
Thank you. And if I could ask you one follow-up question, Karen, can you talk, just give a little bit detail about what the apprenticeship entails for someone who is going through the program?
Yeah, so as Brady mentioned, we definitely have a lot of momentum here in Rhode Island, unlike in some other states. We've established a core training that Brady has taught, and it's actually where I met Brady through Rick. So core training is provided through Rhode Island College, and that's 72 hours of classroom time. And then through our apprenticeship, we also offer more specific training based on our employers. Obviously, it's not just the medical field. So a lot of these additional trainings are provided by the Rhode Island Department of Health, by other collaborative members and organizations, and shared learning sessions.
Thank you.
I will add to that's really important is that the additional trainings that we've identified in Central Providence have been identified by our steering committee members. Our steering committee members identified some of the areas in which they felt was appropriate to learn more about within our zip codes, and then that's when we determine the additional hours. Our multi-employer apprenticeship model expanded into a Providence Housing Authority, Integra, 1MB, Project Weber Renew, Federal Hill House, and Refugee Training Center.
Grace, if you don't mind, if I just add one thing. One thing that people may not know about apprenticeship is the distinction between sort of apprenticeship and internship or some sort of temporary thing. Apprenticeship is really employment, and it's employment with training built in a structured way, and usually a wage progression along the way. So it's a way of growing your own workforce with the intention to keep them, as opposed to some of the more temporary, like job experience things like internship. So it's a really, really good fit, I think, for community pipeline roles like CHWs should be.
Thank you.
Yeah, echoing that too. Oh, sorry, Grace.
No,
but echoing
go for it.
that, to be clear, I'm assistant director of programs, but I actually started as a CHW and then was promoted. So that's the idea, is that folks, whether it's in your organization or within your collaborative, that people are moving up and being provided a livable wage.
Thank you. Marimir, you went through this apprenticeship program, and your employer through the apprenticeship program was the Providence Community Health Center, who, as you noted earlier, continues to employ you today. Can you talk a little bit about your experience of going through the program with other apprentices who are working at other types of organizations, but all kind of learning the same core competencies?
Sure, and I think that you mentioned the key part is that the apprenticeships, well, the one that I signed in for was in 2019. It lasted 2 years, and it was I think a course of 6-7 trainings that you have to take to complete the apprenticeship. And I have to say that one thing that you said is that the community health workers in the apprenticeship, we were from many different settings. There was one from Providence Community Health Centers, one from Integra, one from 1MB, another one for Providence Housing Authority, in many more. We were in many different settings, learning the same thing, but everybody had a different resource or a different knowledge to share. Like everybody had a different level of experience, or everybody had a different level of engagement in the community. I was fairly new to the country, I will say, and I learned so much from the other CHW that share their experiences, what they're finding, and resources in the community that I had no idea that even existed. And I think one of the most beautiful part of the apprenticeship, it's building that connection among the other organizations as well. Like some CHW didn't know where to find a primary care provider for their residents, so they will contact me. If I need assistance from another organization, from West Elmwood, for example, or something like that, I will reach out to them. It's just that we build this community in the community, which is the most beautiful thing, especially for the residents, for the patients, and even for ourselves. We pass that legacy to the ones that are coming into the team. So that's a beautiful thing. And I, as mentioned before, I think it was these apprentices changed my life and changed my career and changed the perspective that I have in the healthcare system. And I have a different perspective in social needs and what do they mean? What do they mean in your health? What do they mean in many other different areas? So yeah.
Thank you. I'm going to ask Surbhi one question, and then I'm going to open it up for anyone who's on the call to ask questions as well. So Surbhi, you mentioned earlier that NeighborWorks has been leading this cohort program for organizations all over the country who are looking to build their own community health worker team and capabilities, and that One Neighborhood Builders is one of the organizations that's in that cohort. Can you tell us some of the things that you and all the other organizations have been learning so far through this kind of peer exchange?
Yeah, and actually, I think we have another one of our cohort members here too. I think I saw St. Mary's, Natalie from St. Mary's here. So hi, Natalie. Quite a few things. I think this Community Health Worker Learning Lab has been insightful for many of our organizations. And I think one of the big things I would point out is resident engagement is key. That comes up repeatedly in many of our training sessions and our conversations. And even more so, the level of engagement that you keep with your residents is also key. So, when you're creating a community health worker program, it's not just about going out and telling the community what they need to be doing. It's really about building a relationship, having that trust. And building trust is challenging. It's really difficult. I think a lot of our organizations have been kind of grappling with how to do that. And then some organizations have just been really excelling in really connecting with their residents and really understanding what their needs are, and also letting them shape what the community health worker program should look like for them. So I think that's one big learning, is that resident engagement is key when it comes to community health worker programs. And another learning I think that's coming out is it's really important to create a supportive and integrated work environment, just even internally within your organization. I think it's important to see, that it's not just one person who's running this community health worker program. Like a lot of your staff have the buy-in to this program and they're invested in this, and there's systems in place where the community health worker program is connected to other pieces of your organization. I think that's something else that's coming out of this community health worker learning lab, is that when you don't have those pieces in place, if let's say you have staff turnover, everything falls apart so quickly, things get paused. And it's really challenging to move things forward. So I think one of the other pieces is definitely understanding that everybody has to be, you really have to create an integrated, supportive environment to keep your program sustainable and be able to serve the community.
Thank you so much. I'm going to open it up to all of our participants now. You're welcome to continue to put questions or comments in the chat, or if you want to shout it out, feel free to unmute yourself and get started. I'm going to pull one question from the chat as we move into this Q&A session, which is kind of a two-part question. One is, do people earn college credit or a degree through the apprenticeship program? So that's question one. And then the second question is, Are folks, are community health workers and apprentices through the community health worker program recruited through One Neighborhood Builders' existing network of folks whom we serve through our other programs? Brady or Karen, maybe?
For the apprenticeship program, no, they do receive the Rhode Island certification as CHWs, and then through the apprenticeship, they're also, it's a nationally recognized credential.
There are apprenticeship programs that involve college credit, not in the case of the CHWs. I think there are some other states that are exploring college credit for CHW apprenticeship or experience, but we don't have that at this time.
Thank you. And Karen, could you maybe tackle the second half of that question too, which is, do our community health workers or folks through the community health worker who are enrolled in the apprenticeship program, where are they recruited from? Where are folks finding this apprenticeship program? And does it have connection to some of the other programs and services that One Neighborhood Builders offers?
Yeah, so our initial cohort that Marimir was a part of was rolled out a little differently than it is now. We learned that as a backbone agency, we've had folks approach us about employing a CHW, and we've done it that way versus recruiting like this one group. We've done it where we're supporting an employer and having them join. So if you are interested, you can reach out to myself or our Dennis, our CHW supervisor, to talk more about onboarding a CHW. We just have found that it happens pretty organically because of our role as a backbone agency.
I might say as well that I could see, I do think that there is a space in the state for more kind of concerted and systemic pipeline strategies. There are examples like RIPEN, the Rhode Island Primary Parent Information Network, that recruits people from their client base. You know, they work with children with disabilities, and when parents are their clients, they see someone with kind of the leadership capacity to be CHWs, they often recruit people in. I'd love to see that kind of pipeline strategy expanded in the state, and both focus on how do we hire from the communities most impacted by health inequities, and how do we empower the existing sort of expertise and kind of community level resources and genius that can be empowered through this sort of thing. And it's hard in that, you know, the traditional ways of recognizing expertise, like college degrees and resumes and things like that, don't necessarily translate here. And how do we look for and empower that kind of community expertise? I think those are important questions and ought to be tackled kind of systemically in the state at this point.
Thank you. Dominic, do you have a question?
Yeah, I have a comment. You know, a short while back, there was this idea that care management was a challenge because it came and went with your healthcare coverage. And this was especially a problem for people who were incarcerated. So if you were very ill and you had a care manager who knew your case and was taking care of you, but then you went into prison, your whole coverage changed and you lost your care manager. And then when you came out, there was this big discontinuation. And one notion that came out of that was this idea that a CHW could be health plan agnostic. So they wouldn't be tied to your coverage, they'd be tied to you as an individual, which has huge benefit for people who have lifelong conditions and problems. So they wouldn't have to have their care management chopped every time they had a change in coverage, which happens frequently with this population. So that's a piece of this that we haven't quite worked out. And CTC, the Care Transformation Collaborative, is working on this notion of, you know, how you could provide a community health worker service that's separate and apart from your coverage, so it follows you rather than have it change every time your health plan changes.
Yeah, Dominic, I think I'm just adding that that's why it's so important for all of us. I think Rhode Island's in the right direction, but for all of us to be on the same page of how we fund community health work, because for community organizations that could do some of the work that you're speaking about, it becomes a lot difficult to sustain and fund these kinds of programs if we're not connected to Medicaid, if we're not an Integra or a PHCHC, it does become really difficult.
Thank you. And I think we also have a question. Ms. Althea, do you have a question?
Yes, my question is, it seems like, correct me if I'm wrong, are most of the people on this line, or all the people on this line, really organizational people, or are there people that are just coming in for the information? Because it seems like you put it on your page for the average Joe, you know, someone that's not really in this, just to get more informational things. And I wanted to know if that's happening, or are we becoming another organization, no thing that just supports other organizations? I don't know if anybody can answer that.
I will try. I don't know if I'll be able to fully answer it. I don't know everyone on this call, so I can't speak for where everyone who's coming to this conversation is coming from. I do know most of the folks who've spoken so far, and I think most of the folks who've spoken so far or are coming to the conversation from the organization or role that where they work, who also work in this field. So that I think that is a correct observation on your behalf, Ms. Althea, but I'd be very open to anyone on the call otherwise raising any point, or if you have anything to share with regards to like what brought you to this call today. And I think also happy to talk about it after the fact in more detail.
I'll add to that, Grace. I think thank you for raising that, because one of the things that we talk about internally is that, you know, many organizations already know the work. And sometimes we're in conversations with folks that know the work and we're just kind of talking about it. And it is really important for folks from the community to be part of the conversation. And I think that has been the reason why I think Dominique is on the call. I won't put her on the spot, but our team has expanded so that we can connect with other residents, so that CHWs can invite folks to these conversations, so that organizations that are much smaller or grassroots organizations can also be part of the conversation. But it also goes to the point that building collaboratives is really difficult. Growing the capacity of our CB team has been something that we've prioritized, but it still takes a lot of time. And you're right, Ms. Sophia, you want to see everybody at the table when we're having these conversations and when we're learning about the work that we're doing.
Okay, then I guess I will go on. We have a lot of people here that are representing a lot of different things. Are you guys bringing this information to your clientele? Is there a way that all of us can bring somebody in that needs to know more about this information, opposed to us? That's how come we fall into the alphabet soup that I talked about. We just all assume everybody knows because we've all been around forever, so we know it. But it'd be interesting if we could all bring somebody in so we can spread that information, because part of the problem is there's a lot of resources out there, but a lot of people aren't getting the information. And I think this is a wonderful platform to get it all out there, you know. And I would just love to see if we could bring more people in so that they can get it and spread it a little bit more, because sometimes we're talking to the same people over and over and over again. You know, it'd be nice if we can get more people. And I know it's hard because a lot of people are either working or, you know, life gets in the way sometimes, but I think maybe if we could just try to get one more person on there that doesn't have anything to do with that a particular topic, but want to know about everything, you know, if we can just get one more person in from each place, it'll be a wonderful thing, you know. I don't know if we can, but if we could just work towards doing that, because I see Dennis, and I see a lot of your faces, and we are becoming a big family, but we got to go talk to our cousins, So that's what I would like to say.
Thank you, and thank you for raising that. I know we're getting close to the end of our time here, and I think that I want to give all of our panelists a final word to share anything that they'd like to, especially if there are any resources or ways to get in touch that you would like for everyone on this call to know about. Please feel free to, as panelists, either leave those in the chat, or if you want to chime in with a final word now, I welcome it.
I think my final word might be that CHWs embody certain kinds of expertise that has been missing in this kind of work. And if that expertise is only doing one-on-one client service of people who are in the hardest situations, that's a miss. I think CHWs need to be talking to leaders, both within our organizations and within the community. I think, like Althea is saying, I think that they're an excellent bridge in connecting communities and systems, but also in training systems and organizations, as well as communities, about the kinds of resources and change that needs to happen. And I think finding ways to put CHWs in those positions to build community and organizational capacity to make change, I think that's where we need to go.
Yeah, I want to say too, seconding what Brady is saying at the end too, it's just share the word about what CHW does. And, if you know somebody that might be a good fit, just look into it. That happened to me. Somebody said, oh, I think that you might be really good for the job. And I did. And, you just never know what change and, such amazing things that you can do in the field. And that's where we need to come together to share the job, to share with people so they know that CHW work exists and we are here to help and be there and do what we need to do to get the community together. So.
Yeah, and just really quickly on my end, community health workers is just, it's a huge area of opportunity, I think, for a lot of housing and community development organizations. You can't deny that, that the social determinants of health mean that you have to consider housing and health in a lot of intersections. And I think this is just a big opportunity for a lot of housing organizations across the country. So just something to look into and something to provide to your communities. It would be great.
I'll echo what Brady said. I think that, we often think about CHWs as folks who know how to navigate the system, but we'd be missing an opportunity if we don't influence the system. CHWs are from the community. They should be part of the conversation. And as Ms. Althea said, I think that's the strength of Rhode Island, is that we've established these health equity zones. But if we really dive into CHW work and embedding it in the health equity zone, we'll see a lot more faces like mine and like Dennis's and Ms. Althea's in these conversations, because, these conversations should never be happening without us. And it's really, I think that CHWs are really key on changing that. So.
Thank you. Thank you all for your time and for taking some of your Friday morning to dedicate to this conversation. My colleague Steve just dropped in the chat a link to a page on One Neighborhood Builder's site that is talks a little bit more about our community health workers and some of the work that they've done over the last few years for those who are interested. I hope to see you all for a future Fresh Friday session. Our next one is scheduled for Friday, July 15th. More details will be coming out in the weeks to come. Thank you so much. Have a great Friday.
Happy Friday.
Thanks, everybody.
Bye, everyone. Have a great day.
Bye.
Take care. Have a good day.